So I'm going to turn the mic over to Cheryl from Catholic Charities Diocese of Cleveland, and she's going to do the introducing, and I'm going to do the round of nothing.
All right. Good afternoon, everyone, and I'm sure we are ready for our next exciting part of our workshop today. So I would like to introduce these fine women behind me. This is Amy Price, who is with Disability Rights of Ohio. She does have her full information in the brochure, so please look at that. But Amy joined Disability Rights of Ohio as an advocate on the abuse and neglect team in April of 2019. In October of 2019, she was promoted to team leader of the abuse and neglect team. In September of 2020, her role further expanded to include the position of Associate Advocacy Director. In June of 21, Amy also assumed responsibilities in the PAIMI Advisory Council and associated grant reporting. Amy has extensive experience at the nonprofit executive level, leadership, and management. She possesses 30 years of experience in the behavioral health care field, including 10 years of shelter and street-based outreach work to individuals experiencing homelessness. She has led leadership positions at the Ohio Department of Mental Health and Addiction Services, where she served as the Chief Client Rights and Community Supports, and at a number of local nonprofit and behavioral health care agencies in Columbus, Ohio. She said I didn't have to read all of it. There's a lot there, but essentially I need to skip over to say, being called to serve, Amy is grateful to be a part of Disability Rights of Ohio. Disability rights work has brought her back to her professional roots, amplifies her core values, and inspires her every day to help change the narrative towards disability justice. So this is Amy, and I would like to also introduce to you right next to her is Jonda Clemings. Jonda has 30 years of experience in the social services field. Jonda has worked in the health, mental health, disability, and homeless and housing fields. Jonda has her Master's of Education in Social Agency Counseling from Dayton University. She received her Bachelor's of Arts right here from AU. There you go. She is also a licensed social. Besides Jonda's professional accomplishments, she is in recovery for major depression and post-traumatic stress disorder. Please let's give it up to these two fine people.
Right. Are we ready to go? Okay, excellent. So first, I want everyone to know that Jonda and I, our professional paths have crossed a number of times throughout our careers, but this is the first time that we get to present anywhere together. So we are really excited about it, or I can speak for myself and say I'm really excited about it. I am going to have the shorter part of the presentation today because although Disability Rights Ohio's work is super important, I feel the most important voice today at the table is Jonda. So I will talk with you all for about 20 minutes, and then the remainder of the presentation is going to belong to Jonda. And I think we are going to try to do some Q&A at the end. I don't know if that was shared, but to save time, we're just going to get into the presentation. Part of disability rights introductions often includes a visual description of oneself, honoring people with visual disabilities. So I'm going to go ahead and start with that. I'm also really happy that I'm sitting down because one of my descriptions is short, and you probably would not have seen me or too much of me over the podium. So once again, my name is Amy. I am a white woman in my mid-50s. I am wearing a black jacket and a green, black, and white shirt. I also have on primarily orange and blue glasses. I am wearing silver and black earrings, and I use the pronouns she, her, and hers. So thank you for letting me do that with you all today. Before I jump into Disability Rights Ohio specifically, we're going to talk about who we are and what we do. And I'm not going to get into the specific work of Disability Rights Ohio, like the specific projects today that we're working on. But I do want to share that Our work is supported primarily by federal grants. And I say that because as we go through the slides, and I'm looking for a clicker. Oh, great, here it is. I will use some of the language that our grantors use. And there's 4 main acronyms that you will see in the slides that I want you to be aware of. One is P&A, and that stands for Protection and Advocacy. The second, well, I'll be familiar with these middle 2 for sure, is SMI, and that's what our grantors use for our PAIMI grant. That's serious mental illness. And that usually describes the adult population with behavioral health conditions that we're going to talk about. SED is serious emotional disturbances. And that is typically used to describe children and youth with behavioral health conditions. And then PAIMI, which we heard earlier, is an acronym, and you'll hear that a lot today. And that stands for Protection and Advocacy for individuals with mental illness. So I want you to have that level set because you will see this in the slides as well. And I'm going to test the slides before I start. Did it move? No, I'm not hitting anything. Is it going? I don't care if someone else does it, or maybe Jonda's closer, she can do it. I can keep talking though, and we can catch up. Okay, so I'm going to share with you who is DRO. One of the things that we have found over our course of probably many years, but definitely the time that I've been at Disability Rights Ohio, there's pockets of people that understand or know about Disability Rights Ohio. And then there's a huge part of the state that doesn't know about our work. So Disability Rights Ohio is a nonprofit agency. Actually, we became a nonprofit back in 2012. Prior to that, we were a state agency, Ohio Legal Rights. And we became a nonprofit, as did all the other PNAs, or many of the PNAs across the country, because a lot of our work happened to be in state licensed facilities, and it was a conflict of interest for us as a state agency to be investigating other state agencies. Our mission is to advocate for an equitable Ohio for people with disabilities. I'm going to narrow my presentation, at least parts of it, to talk specifically about behavioral health, but we represent all people across the state with disabilities. So it could be behavioral health, it could be intellectual and developmental disabilities, it could be physical disabilities or any other disabilities that pop into your mind. We are governed by a board of directors, and our board of directors is representative of people with disabilities. The majority of our members on our board of directors are people with disabilities themselves. And then we have an advisory council that Jonda is going to tell you all about, but it is the PAIMI Advisory Council. And it advises Disability Rights Ohio on our work related to, and I'll use those acronyms to shorten time, SMI and SED individuals within our community. Vision, perfect. So our vision statement is built around a disabilities rights perspective. So our 3 kind of legs on that stool of disability rights are elevating voices, empowering individuals and people also empowering themselves, and equity achieved. We talk a lot about in our work at Disability Rights Ohio about intersectionality. We heard about that earlier. One of my favorite authors, Audre Lorde, talks about that none of us live single issue struggles because our lives are not single issue in nature, right? We heard about disabilities, we've heard about just those cultural aspects such as race, gender, age, class, all of those things intersect when we work in the disability rights and justice space. We also, go ahead, have 5 value statements at Disability Rights Ohio. One is that disability rights are human rights. Should not be surprising to anyone in this room, right? That the folks that we represent, people with disabilities, get to have a voice and direct all aspects of our organization. That we fully embrace our role to protect and advocate for individuals with disabilities. We also empower our constituents to make their own decisions. So we heard about the opposite of that earlier, right? In Rob's presentation, but that's a value we possess. And then once again, people with disabilities have many identities, and we work really hard as one of our values to reach underserved, historically marginalized groups, and to help ensure that there's equitable resources for all. So a little bit more about protection and advocacy. We are designated, Disability Rights Ohio is designated as the Protection and Advocacy System and the Client's Assistance Program for the state of Ohio. We do our work in all 88 counties. I do have some numbers in terms of just individuals served by what is called our PAIMI grant, once again, for behavioral health. We served last year 4,530 individuals with serious mental illness or individuals as a whole, and 10% of those were people with mental illness. Now, those are individual service requests. Disability Rights Ohio, I'll share with you in a few moments, does a lot of project-based and a lot of systemic work that is supported by these grants as well. So every state and territory, US territory, has a federally funded and designated protection and advocacy organization. The governor of each state decides which entity is that for the state. And I've already shared with you that almost all of our funding is from the federal government. In terms of history of the PNA, there was a reporter, some of you in this room will know, Geraldo Rivera, if that name rings a bell in your head. And he did some news broadcasts. He was doing an investigative report at one time in a facility in the state of New York called Willowbrook. So you can Google Willowbrook if you would like. That facility happened to serve individuals with developmental disabilities, but there was a lot of abuse, neglect, lack of programming in that facility. And because of this work that he uncovered in his investigative reporting, around 1975, these PNAs started to pop up across the state and nation. Disability Rights Ohio, one of the ways that we feel we are responsible to our grantors is that we look at our goals and objectives for our agency every single year. And so sometimes we have goals that are multi-year in duration, but sometimes we have new goals that come up for our organization. And we set these goals based on community need, public input, and available resources. And you can go to our website. This is, I think, part of the handouts that everyone has, and look at the goals. I am going to highlight the 8 that we have this year that are related to behavioral health specifically. So the first one is about going into licensed state facilities and making sure that the people who are there, that their lives are free from abuse, neglect, and other rights violations. And so one of the reasons we choose the licensed or state operated facilities is because that is the most restrictive setting that any human can be in. And it is also often the most isolated from other parts of the community. So for mental health or behavioral health, that means that would be like the state psychiatric hospitals, private psychiatric hospitals, youth residential treatment, adult mental health residential. It also means places like jails, prisons, and nursing homes where people with mental illness also reside. Then goal number 2 for the year is about strengthening and expanding the community mental health system here in Ohio. Number 3 is about youth in our community, kids having access to quality services. And all of these goals have objectives as to how we hope to reach these on our website that you can read. The 4th is about students in school, especially younger students, having positive educational outcomes in their school settings. The next is about promoting equity in healthcare. And so still is not completely integrated. So we're talking about behavioral healthcare and physical healthcare settings. We did a lot of work around COVID and access and disparities that existed there. The 6th one is about assisting people to advocate for their own rights. So that self-advocacy piece. The 7th is about conducting outreach and training and reaching those underserved communities and diverse populations again. And then I'll talk a little bit in a few minutes about our statutory access. And so this says enforces our statutory access to facilities, individuals, and their records. And this is the part of our work where Disability Rights Ohio, especially when we believe there is probable cause for abuse and neglect, can enter a facility without the facility's permission and talk to individuals who are residing there to make sure that they are in fact safe. Which is really different than the kinds of information you get if someone signs a release of information, right? All right, so the next is, I am going to share about our funding sources. There's 10 kind of broad areas. And once again, people's lives intersect. So, you know, it's not as clear as just fitting in one of these 10 buckets. But the first one is PAIMI. I shared that with you before, is Protection and Advocacy for Individuals with Mental Illness. Once again, it talks about on those bullets just where we are doing that work. And so the first grant is for people specifically who have a mental health diagnosis. The second one is PAD. They all start with P and A. If you notice that, that's Protection and Advocacy. The next is around individuals with intellectual or developmental disabilities. The third is the Client Assistance Program, and that's about helping individuals access vocational rehabilitation services. The fourth is PAIR, and so this is sort of a catch-all bucket. If someone doesn't fit in one of these other grant categories, but does have a disability, then we can serve them through this particular grant. We have a grant for individuals with traumatic brain injury. We have a grant that is around voting education and voting access. We have a grant around assistive technology. So if folks are not completely clear about what that is, I just like to say it's things that help people communicate and express their needs. So something like a communication board or a wheelchair is part of assistive technology. So getting around in their environment, those kinds of things, a tablet that people use. The next one is PABS, and that is to help individuals facing barriers to employment. So Social Security recipients based on disability. Then there is the representative payee. So we go out and conduct reviews of representative payees to make sure that there is not any financial exploitation occurring. And then the last one is the Work Incentives Planning and Assistance Grant. And that is work that we do around providing benefits analysis and counseling for people who are receiving Social Security based on disability, who are interested in returning to work. So those are all the areas that Disability Rights Ohio works in. And so a person who has a mental illness or behavioral health disability, disability is part of our name. It's like not part of my language, except for when I work here as much, but they could receive assistance in any one of these areas from us at Disability Rights Ohio. I'm going to talk a little bit about the staff at Disability Rights Ohio. So we believe that all staff at Disability Rights Ohio are advocates. We might have attorney and non-attorney advocates, but we're all advocates working to make sure that the rights of people with disabilities are protected and that they're receiving education and that their rights are expanding as well instead of contracting. We also have a policy and communication staff that is educating people across Ohio and policy makers and agencies about disability rights. And then, of course, as all organizations, we have an operations and a fiscal team, but our fiscal team has the grand job of making sure we don't run out of any of these grant dollars so we can provide services throughout the entire year. All right. Now, how does someone become connected with Disability Rights Ohio? All of our assistance for all of those programs starts with our intake team, right? So even though I'm sitting here presenting to you all today, and I lead our abuse and neglect team, people would not call me for an abuse and neglect issue. So through our intake team, you can call the number that's up there. We have a web-based intake form, or you can write to us, right? So oftentimes people from jails and prisons write to us. There's no really confidential form of communications coming out of jails and prisons in the other formats. Who is eligible for our services? Once again, it's people with disabilities, all disabilities that I talked about before. There is no income requirement. And none of the people that we provide services to receive a charge for any of those services. Now, our advocacy, when you think of advocacy, we do have some nuanced aspects. So here are the four that we're pulling out today. One is client directed. Now, this means something different to Disability Rights Ohio staff. My other life before Disability Rights Ohio, I'm a licensed independent social worker. So we always talk about, is this work client directed? Is it client centered? But what client directed here means, and I'll just use myself as an example, is there might be a client by the name, a person by the name of Amy who has a disability. And Amy is, I don't know, in a private psychiatric hospital. So her friend, her guardian, somebody calls because something nefarious, something bad is happening to Amy in this facility. Our intake team would take that call. The next thing that would happen is that our intake team would get, either the intake team or the team that it might be assigned the case would call Amy or go and see Amy and say, hey, we got a call, a concern about you. And this is what the call was. Do you want us to do anything about that? Amy might say, yes, please. This is horrible here. Or Amy might say, no, it's going to make it worse if you say anything about me. We might counsel Amy and say, you know, they cannot do anything to you by us looking, right? It's your right to have this looked into. But Amy might say, no, I'm good. And then we walk away. It's client directed. Amy might say yes. And halfway through, after 3-4 weeks working with Amy, she's like, I'm good now. You can go away. We'll go away. Amy gets to direct what happens. This unaccompanied access is also unusual, and that is part of our access authority. So that means not only can I, as the abuse and neglect team now, go into a facility, I can say, hey, staff, I get to look around without you. Now, not everyone likes that, right? So we have access attorneys that help make sure that we can get in when that happens. It also means that interactions with Amy, the client, are private and confidential. So that means I can say, no, staff, Amy has the right to talk to me by herself, and you need to give us a private space to do that in. And it also means that I tell Amy, hey, we're gonna have this conversation. I really am interested. Sometimes we have a list of questions that we go through. Sometimes it's more organic. But anything you say to me, Amy, is confidential. I will not share it with the facility unless there's a specific advocacy need that you want us to advocate for you. And you have to give me your permission for me to talk to the facility about that issue. We do the individual advocacy like that, and we do also broader systemic advocacy. So we might look at a group of youth residential treatment centers, or we might do, I'm trying to think of mental health side. We do a lot of things with developmental disabilities, but community waivers, so you don't have to stay in this, institution. You can have supports in the community. You can have a different life. This important note up here is that Disability Rights Ohio is not a service provider within any system of care. That makes us different. So we are not the entity that's writing individualized service plans or behavior plans or applying for benefits or case managing, taking people to get grocery store. We are there to advocate for rights, education, and protection, which is a different lens. And that's why I wanted to take a little time to explain just the nuance of our type of advocacy work. There are some additional examples of kind of the work that we do on this slide, right? So we also monitor facilities to make sure there is compliance across all the facilities that we go into across the state. The abuse and neglect team, as well as some of our other special issue teams, conduct some of that work. But the team that I run, the abuse and neglect team, there's 5 of us, and we cover the entire state for all of the different disability populations that we talked about earlier. Right, individual and systemic advocacy. So we provide information and referrals from our intake team. We do trainings and provide assistance around self-advocacy, because ideally that's what is best for everyone. We do provide some limited representation, often in the form of negotiation. So that's more, think about the legal side of things. We also are present when indicated for administrative hearings, and lawsuits really in our world are more systemic class action types of lawsuits than individual lawsuits. We get lots of people that call and want an attorney, for example. We have 8 special issue teams. And so like all the things I talked about, we then narrow it into sort of content areas, if that makes sense. So we have a short-term assistance team. Really, they do a vast array of work on a vast array of topics, but for shorter durations of time. The abuse and neglect team. We have a civil rights and integration team. We have a special education team, which works in schools. That's another place that we go as well. We have the CAP team, the Social Security team, the representative payee team, and the workforce incentive and planning team. And so what happens is when that call comes in through intake decides based on what they're hearing, which one of these teams is the best fit for that call. If they cannot handle the need at the time that the call comes into intake, right? If it's beyond what they can do, then they will refer to one of these special issue teams. So something that I think might naturally come to my team might end up on another team, right? And so that's why we funnel it that way. And we also, it helps to ensure that nobody's calls are getting missed or, inquiries. We also have some other arms that are really important to us. Policy advocacy is hugely important to us. And this focuses often on educating policymakers. Also, not only educating, but sometimes testifying on legislation. Creating forums and places that help people with disabilities speak up is another role of our policy advocacy team. And then working with other advocates to protect rights or increase access to services. And then we have an even more specialized arm called community engagement. And I am going to have Alexia raise her hand. She may not hear me. She is our community engagement coordinator at Disability Rights Ohio and does an awesome job. She also works with our PAIMI advisory council, but I'm trying not to steal anything from Jonda's plate. So in this role, right, in terms of community engagement, we're looking at providing information through websites and social media. We offer trainings on disability rights to individuals who have disabilities, to their family members or other advocates. And we do outreach like this at disability conferences. Next one. We have a resource center on our website, and there is a web link for that. It's organized by topic. Actually, before I ever started at Disability Rights Ohio, I went to their website to find things. And there's some really good resources. If you come across something that you feel is outdated, please let us know. Anytime you have a resource center, it's easy to get something that slips through the cracks, right? But please let us know, and please use it. Please encourage others to use it. And then in terms of language support, we do offer language translation and interpreter services to people who are calling in need of our services. Just the one caveat is just have the person state that need, right? We won't know that need exists until someone shares that need with us. So just please ask and we will accommodate that. And then my last 2 slides really are about our website and social media. So the website's at the top of the last 2 slides. We have Facebook, Twitter, and Instagram handles. They're all on these slides. And then you are welcome to join our email list. And we put a lot of things out through there. Things, you know, that we're looking at as an organization. There's an opportunity when I talked about those goals and objectives, those kinds of things get sent out when we're doing annual goal and objective setting. So if you're part of the email list, you would have a voice in, you know, contributing to what the most important priorities are from your perspective. And we kind of consolidate all of those. So that's who Disability Rights Ohio is in the work that we do. Now I'm going to turn it over to Jonda and let her talk about the PAIMI Advisory Council. And I'm going to jump and say we have, besides Jonda, right, some other PAIMI Advisory Council members in the room. So if they'd like to raise their hand, 2 of them might not hear us right now, but there's 2 at this table and there's 2 in the back table and Jonda. So are you good with the clicker since you're closer?
I think so. We'll see. If I forget to advance it, just throw something at me.
Or I can sit on the step and do it.
First off, thank you so much for letting me come today. Being able to talk about my journey through my own mental health issues and the advocacy that I'm able to do around that is very near and dear to my heart. And I'm glad to be in a room with others that have similar feelings. So as Amy said, the PAIMI stands for Protection and Advocacy for Individuals with Mental Illness. And I'm just going to shorten that to PAIMI just for ease, and that's usually how I call it versus the full name. Up next, we're going to talk about the role of the Advisory Council. One of the things that we do is advise DRO and their board on issues of people with mental illness, people living with mental illness, and the mental health services that they receive throughout their local communities, the state hospitals, private hospitals, community behavioral health, whatever that might be. We also hope to promote recovery through increased access to client rights and advocacy services. So not only sharing what we do as far as our individual role being in PAIMI Council, but also trying to take the other issues that are around mental health and illness to the next step and see what we can do to make changes to the system.
Click a couple times. There we go.
Okay. Our membership consists of at least 60% of those individuals who have serious mental illness, or they have a family member that has a serious mental illness diagnosis. You must also reside in the state of Ohio to participate in ours. As Amy mentioned, there is not only a disability rights organization in every state, there's a PAIMI council in every state of the union. So we have opportunities for you that are out of state to also participate in those councils if you so choose. We also try to get a well-rounded body to our council. So we take a look at diversity needs such as race, diversity as far as location in the part of Ohio that they're going to be representing, LGBTQ issues, number of things that we look at just to make sure that we're trying to get the best representation stuff that we can for our council. Others interested in, others that can serve on the council are mental health professionals, individuals with knowledge about mental health and mental illness, providers of services, individuals, as I said, that have been receiving mental health services or their family members. We also have to have a parent of a minor child on our council. And by the way, we're looking for somebody like that. So if you are in that kind of situation, please talk to Amy or I afterwards, and we'll be able to get you some more information as far as joining our council.
Yes, this is shameless recruitment for this council.
The council members serve 4 years. You are eligible to renew after 4 years, but you have to be off the council for 1 year before you can qualify again. One of the things that we try to do is promote the legal and civil rights of persons with mental illness by advocating for professional and personal choices. And I think we've talked about that so much already today, as far as those that are voluntary or involuntary receiving services. We want to make sure that it's voluntary services that people are receiving, and that's the type of services that they're wanting to be on. We ask that each member participate in a quarterly meeting. We are doing 3 of those video Zoom meetings this year, and we're going to do 1 in-person meeting. We haven't done any of those since PAIMI, or since PAIMI, since COVID started. So we're going to have the opportunity to actually meet and greet each other in person and get to see each other and have some really good discussion. We also have some subcommittees that participants on the council can spend their time on, working with others with similar interests. And I'm going to go into those in just a few minutes. Some of the activities that we try to do as a council is share information with DRO on the budget that's spent for PAIMI related activities, and any grievances that DRO has received for any PAIMI eligible individuals that have received services from them. So we take a look at that and make sure that there's no trends or anything that we have to worry about. And DRO, as always, has done a wonderful job at making sure that they're taking care of everyone on an equal and responsive basis. We ask that individuals that serving on the council provide their input on policies and priorities that that DRO should take on during the year. Sometimes there's a disagreement with what DRO thinks and what PAIMI council is encouraging people to do, and we try to negotiate that with the board of directors and DRO staff to see that our individual thoughts and the communities that we represent are being taken into consideration. One of the things that we do is complete a report. You can't do anything without documenting it, if you haven't heard that before. And we do an annual council report that the P&A system has to complete on an annual basis. There's a specific spot on there for PAIMI related activities and what the activity council is doing. So we help with that report. We also make sure that our chair of the PAIMI council serves on DRO's governing board as well, so that they can provide information back and forth between the council and the DRO board. We look at our operating standards, at least on an annual basis, to make sure that we are doing the types of things that we should be doing and emphasizing the tasks that are put before us. We get support from our PAIMI coordinator, Alexia, as Amy mentioned, is the person responsible for that. So she takes really good care of us and keeps us on track, which is kind of hard at times. We also we also help with the completion of a PAIMI program performance report that specifically talks about the activities and accomplishments of the PAIMI council. There we go. One of the other things that we do is advise DRO on information impacting community mental health and individuals with SMI and SED. And we also provide feedback, as I mentioned, to DRO and the board of directors on anything during the year and work on goals and objectives towards meeting those. We're in the process of doing some planning right now to do some community meetings. We're looking at going into 2 of the state psychiatric hospitals to educate them on DRO's actual business at hand that Amy just went over as far as what they can do to help those out that are in the state psychiatric hospital. And we're also going to have a listening session where we're going to ask some very pointed questions of the individuals that participate so that we can get a better feel for those that are in the state psychiatric hospital.
Rob can help you with some questions if you need any help.
Oh, wonderful. Great.
Yeah.
At our quarterly meetings, we try to look at the goals and objectives that we've set for the year. We review the PAIMI application that goes into SAMHSA. And we also review the program performance report and the advisory council reports. We share any information as far as concerns about the budget or grievance, and we update any ongoing goals and stuff that we're working on. We try to make sure that we are continuously trying to get input from members of the community and systems throughout the state so that we can have them in mind when we're setting our goals and objectives. Amy did take my thunder a little bit. I was going to introduce a couple members of our staff and the PAC members. So Christina K, or KK over here, she is actually our chair this year for the PAIMI Council. She's responsible for seeing through to the meetings and presides at meetings. I'm the vice chair, and I sort of fill in if KK has anything. We are open a seat on the secretary's position, and Jeannie Weber, who is in the back, is on our nominating chair, and she's responsible for seeking diverse memberships for the PAC. We also have a policy leadership chair. She wasn't able to be with us today, and a diversity chair. And those are the committees that we have as part of our PAC committee.
We are down to less than 10 minutes.
Okay.
If we want any
How many more do you
questions
have left?
from our
About
audience.
6. Okay, you can keep going. Do you want to keep going?
Just, are there any questions?
Okay. You can there see if there's anything that's in there. I think I
Yeah,
went
I was
over.
wondering, so I know someone who has multiple disabilities, and she had mentioned to me that her payee, what she was running out of money. So I didn't know, do I give the lady the information to contact you guys? Or do I tell her I know where and you know where I can get her help maybe? But I just think it's a crime that this woman had her gas bill shut off, and I mean, they don't help her with anything. I feel bad for her.
So to answer your primary question in there, you would give her our intake number, which is on the slides, and have her call. If she's unable to do that, you can have someone assist her with that call, but also explain to her before we would do anything regarding that concern, someone from our organization would reach out to her. So whichever way works best for her is fine.
I have 2 questions. They might be related. But I'm curious, what recommendations the PAIMI counselors made to the PAIMI? And then what are the priorities for the PAIMI? I'm most curious about because the mental health illness and this treatment, where does that stack up on the list of priorities in terms of the city request those things? So they might be similar, but I don't know because another PAIMI with some advice or recommendations from the PAIMI council, so I'm not sure.
Okay. You might have to remind me of the second question when it comes time, but We are currently working on several different goals and objectives as far as our plan for this next year. One of the things is actually getting out into the community and spending some time doing some listening sessions with folks so that we can get a better in-depth knowledge of what their thoughts and feelings are around their mental health care. We are also looking at how we can provide more guidance to DRO in the circumstance of trying to make sure that our voice is being firmly held with DRO when they're taking things into considerations. We have, I think, 8 other goals and objectives that we're working on right now, and I'll be darned if I can think of them, so I apologize. And your second question again?
Was, the priorities for disability rights Ohio in general.
Okay.
Where does the issue of mental health courts and forced treatment stack up on your list of priorities? I know, sometimes those are shifting for a lot of different reasons. So I'm just curious. Is that
Yeah, I'll let you take that one. Yeah, I know.
how much attention is going to?
So that's a great question. Thanks for asking it. So first of all, with our priorities, we don't number like number 1, number 2, what is the top priority for Disability Rights Ohio. However, in regards to forced commitment, people who are voluntarily committed, we work on the policy side, you know, when there is stuff with the legislature that comes up that are related to those issues, our policy team takes those. And then our special issue teams do work on things related to forced commitment and involuntary commitment. So like one case that I worked on or our team worked on was about somebody who believes that they were not given all of their rights from the time that they had an interface with the police to their admission at the hospital. So we looked at that situation for them as well. We're doing a lot of work around alternatives to policing as well, in terms of interventions when there may be a behavioral health situation. And the first thought is to call the police, and some not so good things happen often when that takes place. And so looking and advocating within our state about alternatives to police intervention as well. So I don't mean to like not answer it directly head on, but we have multiple arms that are looking at that issue. To say it's the top priority or the bottom priority would be a misstatement. It is an issue that remains on our radar, and it's one of those multi-year goals and objectives that we have. And I went over the 8 goals, but you can go to our website and see all the goals and corresponding objectives for the PAIMI Council and the PNA. They're the same. So, yeah.
We have time for one more question.
Kind of along those lines.
Sure.
I was wondering if either of the organizations would have the influence to ask that these institutions would provide the data that's missing that Rob was talking about, like how many involuntary treatments were there, or and what results were those types of things in order to do your advocacy. Does that make sense?
Yeah, it's a great question. So for the work around involuntary commitment to, say, state licensed facilities, right? The keeper in Ohio for that data would primarily be the Department of Mental Health and Addiction Services. Now, people can make public records requests for that to them. Say again? Yeah. And the timing of that, they have a whole timeline set out, you know, in their code by how long they have to respond to that. That is the entity we can advocate with to get that data. Ohio's an interesting state because we have a board right here, but there's 88 counties and how many boards? 50 boards, is that right, in our state? And so it's sort of fragmented in that way. But we push the Department of Mental Health and Addiction Services. Ultimately above them is the governor that we would have to advocate for to get that kind of data.
And we do have an ex officio on our PAIMI council that is from the Department of Mental Health and Addictive Services. And she tries to provide us an overview of what objectives and stuff that they're working on at the state at each one of our meetings.
Yeah. And so, yeah, Jonda and I are the same, yet a little different, right? So Disability Rights Ohio is the PNA. And then we have a board of directors and we have the PAIMI Advisory Council. And their role is to advise us on those goals and objectives. So we represent the same entity today for the most part.
Thank you, Evie and Jonda.
Sure.
Very quickly, Ashley, are there any questions on the chat for Q&A?
Nope, we don't have any online questions. Thank you for asking them.
Okay, thank you very much. We're going to take a quick comfort break, 5 minutes, and then we'll be right back here. Thank you.